So I just wanted to reiterate what the discussion, what we would like you to focus on in the discussion on the World Cafe. So in fact, we start with, we already discussed it a lot, but the scope of the challenge we face nowadays is really unprecedented with this rapid urbanization and the increased health inequalities we see coming with that, the unfinished agenda for infectious diseases, the emerging threat of new diseases constantly there, and on the other side of the crossroad, this rising burden of chronic diseases. So our health systems are absolutely not prepared to face these in many low and middle income countries specifically. And we see that non-communicable diseases is a ubiquitous problem, but the lowest income countries are hit hardest. And 4 out of 5 deaths of non-communicable or chronic diseases occur in low and middle income countries. Meaning, if you take the example of high blood pressure, the #1 killer in the world nowadays, a silent killer, it's killing more than 10 million people a year, which is as many as all infectious diseases combined, AIDS, TB, malaria, measles, name it. 10 million is more than all of those together. So on top of that, we an enormous loss in the healthcare systems, but the loss due to non-communicable diseases in economic development in low and middle income countries and globally is estimated at $47 trillion from now till 15 years, which is not neglectable. So this, in fact, with the current state of our health systems in the world, it calls for innovating on the one hand, the way the healthcare and the prevention is delivered, but not only that, and I show a picture of people on a bike because that's how it happens still now, going from village to see patients and make sure they get the treatment they need. Nowadays, you can maybe coach these health workers by phone and do it much faster. So that was really something that didn't exist before. But now it also calls for looking at bringing our different disciplines, our expertises together to address the whole global health challenge in its entirety, to also take care of these underlying determinants. As Jennifer was explaining, you have to know what the educational parameters are that put you at risk for certain diseases. You have to know what the physical activity level of the persons are. You have to know the smoking habits and all these things. So you need a multidisciplinary approach to address all the underlying determinants of health. And if we take the example of cardiovascular diseases, I just use that because it's the easiest one and anyway it's the biggest problem in the world. It's a free translation of the public health pyramid of Tom Frieden, this one. But if you look at the underlying determinants, which is all linked to your exercise level, your smoking, your food habits, your alcohol consumption, and also air pollution, the determinants for the major NCDs in the world, these cannot be addressed by the health system. The healthcare system can only do top of the iceberg when people really get a serious complication or need a treatment. So we have to work together with other partners from other sectors, and that's why it's so beautiful to have all of you, different sectors and disciplines in the groups around the tables together to discuss this today. Only then can we think about how to improve healthcare, the healthcare provision in SE, if you want. So you already know there's colleagues from the healthcare sector, from the IT sector in the room, but also there's colleagues from the transport infrastructure, the food industry, consumer goods industry. There's colleagues from financial and insurance companies, from the energy sector, both from public and private sector. So please join all your brains and minds to bring up collective insights in the discussion of the World Cafe. Now, how is it going to work? We want to learn from you, so we want to collect your input. So the first questions you will have to answer is that, how can digital technology really enable a multidisciplinary approach to health? A little bit what we just heard in the last panel. And in which sectors, besides the healthcare and the digital sector, would digital be leveraged first to really address these underlying determinants? What is for you the first thing to do? If you were a government or a policymaker, what would be the first investment you choose to put your bets on? And how it works? Well, you get a first question. You work for, I think, about half an hour we have, Rachel, I think, in the first question, more or less. Then we will ask you to stop and we will collect some of the tables we will ask 1 or 2 tables to report back to the group what their outcome was. You please take note on these papers you got from Katie and Priyanka. Then we can also collect it afterwards from the entire group and build it in a couple of slides that we can maybe communicate after with Rachel for introducing in the proceedings of this meeting. And then you get a second question, which is obviously related, how you translate that into action. And then we harvest the results of the second question. So for that, I would love you to start working on the first question, which is going to be really looking at the different sectors you have around the table. Hopefully you are well mixed, but if you miss one sector, just don't forget that sector. It's not because it's not in your group, but these are the sectors that are represented. So for each of these, you'd select the 3 first ones you would apply digital to make sure that it's addressing the risk factors, the underlying determinants of health. And then for these 3 sectors, or if you only have 2, it's also fine, you define the main lines of action. How is it that it's going to work? And then this is the paper you find on your table. When you fill that in, we collect it, and we go to the second question, which is going to be, when you consider those action points, how do you translate it into real action? What can the healthcare sector drive, and what can the digital sector drive? So we heard there's a lot the digital sector can drive, much more than the healthcare sector thinks or knows, I feel personally. So we have to really look further than what we are used to. Think blue sky, think out of the box, and be as visionary but also realistic as possible. And then we will harvest the second part and come back to you also with 1 or 2 groups who report back to the whole group, and then in the overall, in the report of the meeting. I realize I flew over it, but I hope it's clear. The first question is not so complicated, so I leave this for you. Please, the floor is yours. Select someone who will take note at your table, and then we can collect, at the end of the session, 2 groups who will report back to the rest of the group. Okay? Go ahead. We have until 20 past 12 for the first question.